Welcome students, welcome to this presentation on demand for health. As I shared with you earlier, a seminal paper gives a lot of ideas of understanding the subject quite differently, and it also throws up areas which can be taken up for research or for dissertation for the postgraduate students. So let me talk about Michael Grossman and his 1972 paper on the concept of health capital and the demand for health. By now, I'm sure that you're aware of the concept of human capital, where we make investments in different forms of human capital, and that increases the productivity of labor. Here, Grossman introduces the concept of health capital, and he uses terms like health as a consumption good and health as an investment good. In normal thinking, we don't understand health as an investment good, nor do we think about it health as a consumption good. So let's see how Grossman has tried to give these two terms and how these two terms acquire different meaning in the context of health. Health involves cost, it involves direct outlays on market goods that we consume, and it also involves opportunity cost. Opportunity cost is the next best alternative that we forego to get something else. Here he says that health is a durable stock. Now, when we say health is a durable stock, we mean the stock of health a person has at any given point of time. We use words like stock and flow in economics. Stock means at any given point of time. To make it simple, let me say a water tank is a stock. At a given point of time, what is the total quantity of water that is available in the tank is called as stock. So here, the human being has health as a stock. And the flow, what is the flow? The tap, when we put on the tap, the water that comes out is known as the flow. So here, when we talk about a human being having a stock of capital, then we say that there is a flow of that health also for the person to enjoy. Now, what is that flow? The flow is the healthy time that comes out of that stock of capital. And this healthy time is a time available to a person which he or she can spend in producing money, earnings, and commodities. So, if the stock of health is good, then the flow that will come out of that stock is the healthy time, and this healthy time means the person can engage himself or herself in producing goods and services and earnings. Now, medical care is one of the inputs in the production of health. So, how do we produce health? Medical care is one of the production inputs. Grossman assumes that each individual inherits a certain stock of health that is more of a biological matter, and this health of an individual accumulates over time. It gains from all the investments that we make in health. Now, what are the investments that we make in health? These investments could be the medical care that we have given in terms of vaccination or other things. We will just see that. So, there are investments made in people, and this investment in health accumulates the stock of health for a person. So these stock, again, he says that this stock, we cannot continuously increase the stock of capital because this stock of capital is also subject to diminishing returns, or it depreciates over time. So in economics, when we say diminishing returns, we mean that as we use more and more inputs, the output that we get goes on diminishing. So there is a limit beyond which we cannot make investments in health, and the quality of healthy time will reduce as time goes by. He also examines the issue of death and says death occurs at a time when the stock of capital falls below a certain level. So if the stock of capital is very low, then according to Grossman, death occurs. Individuals can also choose. What is the here choice? Individuals can choose the length of time of life by making investments in health. Now, how do you choose the length of life? We know this concept has been applied in development policies, where we can see that countries have worked on to increase the longevity of people. How do we increase the longevity of people? By making investments in health. So that is an idea that you can see from here. How, when we make investments in health, the person can choose his or her length of life. So that's the idea of the demand. Let's look at how the idea of health itself is produced according to Grossman. Health is produced by households. Now, how do households produce health? Inputs are one's own time. So an individual has to invest time in getting oneself healthy. So this time that one invests in getting oneself healthy is by taking care of the food that one eats, the water that one drinks, the medical care that one requires and gets when a person falls sick, or the exercise that we need to take care of, and the recreation, housing, sleep. All of these are investments that we do in health. And these are the goods that a consumer has to consume to make his stock of health increase. It also depends on external variables like external variable, or called as environmental variables, of which he considers education to be an important one. So when a person is educated, he or she understands the issue of health better, understands the ideas about exercise and sleep and food and all of that better. Therefore, he says that education has got a positive influence on the stock of health, because it influences the efficiency with which health is produced. What is this demand for health? Now, demand for health is seen as a consumption commodity, and it is also seen as an investment commodity. So, there are two reasons, according to Grossman, why health is demanded: as an investment commodity and as a consumption commodity. As a consumption commodity, it directly enters into the preference functions of the consumer. Now we know that a consumer has got a budget constraint, and within the budget constraint, the consumer decides what are those commodities it wants to purchase with the available resources. So health falls within the preference functions of the individual, because if a person is sick, then it falls within the spending of the family or of that individual. Each individual, when he spends money on health, wants to maximize the utility that he gets from spending on health, wants to minimize the disutility, or what is called as the sick days. So nobody wants to be sick. So we want to get well soon, and therefore we spend money on getting well soon, and it is within the consumption of this person. And consumers select a combination of health in his total expenditure in such a way that it maximizes their function subject to the income or resources. So what is the income that a person has? So within the given income, a person will try to get the maximum amount of health that is possible. So those who have very high income can go to very high end specialized hospitals, and those who have very little income would rather go to a government hospital or a dispensary and get themselves treated. So the income that a person has also decides the kind of healthcare that a person can obtain. Health is also seen as an investment commodity. Now, as an investment commodity, it is the acquisition of health stock. Now, this health stock, as we just spoke, is lost from, when a person is healthy, then a person can prevent the time that he loses from carrying on non-market activity market activities. What it means is that when a person is healthy, then he can carry on his market activities of production of goods and services from which he gets an earning. But when a person is ill, then he has to lose time from carrying out those activities and spend that time on recuperating from poor health. So there is an opportunity cost of time that must be withdrawn from competing uses. So when a person is suffering from COVID, he or she has withdrawn time from carrying out the normal activities that he or she has. In this case, if it was possible for him to earn something, that earning is lost because he has to withdraw that time from working to taking care of his health. That is the opportunity cost. He has lost the possibility of earning an income because he is sick. Then when a person is sick, there is also a reduction in the monetary value of the goods and services that he could have otherwise produced. In that case, we say that there is a loss of health. The measurement of the loss of health can be measured in the time that is lost in having bad health. So consumers also select an optimal quantity of health. That means there cannot be endless demand for health in that sense, because the budget always restricts the quantity of health that a person has. So this selects each individual selects the optimum quantity of health in any given period of his life. So a person may decide what should be the quantity of investment on health that he may like to do when he is, let's say, an 80-year-old person, and what is the quantity of health that a mother would like to spend on a child who is a 10-year-old. So there is a variation in the expenditure on health according to the age of a person. Let's look at also the law of demand as applied to health. Now, the demand for health is negatively related to shadow price. So we know that demand is negatively related to price. That means as price of something rises, then the quantity demanded of that commodity reduces. Here, the price of shadow price. Why do we use the word shadow price here? It is because the price of medical care is just one of the costs of health. There are other costs of health, like what I said, going to the gym and getting an exercise done, or going to living in a clean house, or any of these kind of things can happen. So these are all the expenditures that one incurs to get good health. So if the cost of these kind of expenditures increase, then the quantity of medical care that he demands will be reduced. So the demand for all the changes in the cost of these shadow variables alter the derived demand for investment. So if the person is enjoying good health because he has invested in all of these activities, then the demand for healthcare itself will reduce. Then shadow price rises with age. So as a person ages, then the amount of money that has to be spent on keeping a person healthy increases if the rate of depreciation of the stock rises over the life cycle. That we can understand that as we grow older, the demand for keeping good health continues to increase. He also makes a mention that if a person is educated, then the shadow price that he has to spend on attaining good health reduces, because a person would be taking care of himself or herself well in terms of food that he has, or the water that one drinks, or the cleanliness of the surrounding of the place. All of these are related to education. So if a person has invested in education, then the investment in healthcare can be reduced, assuming that they are, because the educated people are more efficient as producers of health. Unfortunately, we also see educated persons are the ones who are suffering more from diseases that can be easily prevented. So in such cases, we understand that education is not providing a situation for a person to enjoy a good stock of capital. These are interesting areas that young students like you can spend on researching. So, as postgraduate students, you'll find these topics interesting to take up for your research, or even for doctoral studies, you will find these areas as interesting, the link between these kind of variables. In certain condition, an increase in the shadow price may simultaneously reduce the quantity of health demanded. Yes. So if a person is healthy, if a person has invested in good health and he has increased the stock of capital, then definitely the demand for healthcare will reduce. If one person regularly does exercises and keeps oneself fit, then the demand for health itself will reduce. And the quantity and if a person is not spending that much time on health, then it is quite possible that the demand for health itself will rise simultaneously. Now, these were the ideas of Grossman, who connected health as an investment good and health as a consumption good, and why we need to make investment in our health so that we can get more healthy time and we can produce goods and services which can give us an earning. And health does enter into our consumption as a consumption good, and that the health depreciates over time because there is the law of diminishing returns that apply. So these are new terms in economics where we generally don't understand these terms as health. But if research has to be done, we have to conceptualize these ideas. Only then you can look at the topics of interesting areas in research. Now, here on what I'm saying is these are not from Grossman's work, but these are talking about the nature of demand for health. So, the demand for health itself is a derived demand. Nobody demands health for the sake of health. It is because one can enjoy healthy time, one can be peaceful, one can travel, one can carry on with sports and all of these that adventures and whatever. That is why the demand for health is concerned. So this derive for is a derived demand, and there is also infinite. So anybody would like to be as healthy as possible at all times. So there is this need for demand which is infinite, but then we know that there is a scarcity of resources that we have, and therefore there is a limit to which we can demand health. So health cannot be demanded unlimited in an unlimited amount. The outcome of health is, of course, uncertain. We have seen that in Kenneth Arrow's paper, and there could be chronic diseases that a person suffers, because of which, again, a person may go through this problem of spending too much of resources on getting back to health. So, the condition of being unhealthy is unpleasant. It also is a case of disutility, and therefore, any rational consumer that we talk about in economics would be interested in minimizing these unpleasant or painful experiences and want to experience or regain the good health at the earliest. So, that is where we talk about the need to recuperate from illness, and how an individual would like to get back his or her health at the earliest, not only because a person is sick, but also a person may want to get back to his or her earning activities. And also, we say that in case of the demand for health, individuals are not aware of the various alternatives that are available for treating a particular kind of disease. And again, the asymmetrical information comes into play here. Now, there is in economics the idea of substitutes. Now, what is a substitute? A commodity that can do almost the same function as the first commodity. So, tea and coffee are considered to be substitutes. There are very many brands of oil which are considered to be substitutes. Now, let's apply this concept of substitutes to health and see what happens when we want to know whether there are substitutes available for health. Unfortunately, the substitutes available for health are never close substitutes. They are at the best some substitute available. For example, a dialysis machine for a person who has a kidney problem. The dialysis is a way to substitute the working of the non-functioning kidney, but dialysis is never the perfect substitute of the kidney, nor can be a walker be a substitute for an individual walking on his own. So these kind of substitutes in medical care is very, very far away, and there are no perfect substitutes for medical, though technology is working and inventing many things that can be near substitutes to human organs that we are born with. So there is also low price elasticity, which means that if an individual wants to get an alternative to kind of medical care to the other, there also the price elasticity is very low, simply because in one scheme of medicine, almost all the medicines are of equal price. So the elasticity is low, and persons often land up paying very high prices for medical care. That is what we have seen in the recent illness, how people have had no substitutes at all because it is a relatively inelastic demand. People end up paying huge amounts of money just so that a person can get well soon. Now, these are the general factors that affect health, and these are can be looked at from both the micro perspective and macro perspective. I've just listed them for you. So, food intake is an important variable that affects demand for health. So, if a person, now let's take the example of a mother, a pregnant mother. Now, if food is given to her, then we can reduce the maternal mortality. If children are given food at school, midday meal schemes are given, then it helps children to grow better and also to study better. So these kind of health policies that the government makes are meant to provide health indirectly to people rather than seeking medical care. So these are the ways of preventing a loss of life and loss of earning because of poor health. Access to clean water is another one which only the government can provide, and therefore, when the government provides health, clean water, we can prevent uh, citizens from contacting or getting infected by infectious diseases like cholera, typhoid, or jaundice, and therefore they can continue to enjoy their earning life rather than spending time on getting themselves cured, spending money on getting themselves cured, and also losing time on their earning. Sanitary and housing condition, again, we have seen that when sanitation is poor, when open defecation happens, then children fall sick, and there is a unhealthy environment that is prevailing. So the need for providing sanitation, the need for providing good housing, because we saw just now that when the housing conditions are poor, when the houses are crowded, the transmission of these diseases are much more than when it is distance located. Of course, when we have large population, that also affects the demand for health. Now, the country that we are, the demand for health care for COVID is far, far greater than the healthcare that is demanded in other countries because of the sheer size of the population that we have. Also, the demand for healthcare is affected by the age distribution. So, if we have more geriatric population, if we have more elderly population, then the demand for health will be of a totally different kind than if we have young children, when the demand for health is of totally different nature. So the demand for healthcare is also affected by the age distribution of the population. Availability of health service, if health services are not available in remote villages, for example, then people would die from whatever they have fallen ill, because they don't have hospitals to reach or primary health centers to reach. So this availability of health services and technological development can also help a large number of people from enjoying good health. We can also see there's a social system, there's a support system that is available for them, to take them to hospital and to take them during times when they are ill. All these can affect the demand for health. If a person is alone and a person does not have a social capital in a far along city to take care of his or her health, then a person may suffer from the disease rather than getting cured away from that disease. Having stable governments and institutions is important, because that allows people to have faith in the government, and therefore government provides these facilities like food and vaccination and maternal health and lactating mothers. All of these are provided by the whole, government if the institutions are powerful and if the governments are also stable. We also find that community development, community empowerment is very important. For example, the availability of trained midwives are very important for preventing maternal mortality when these trained midwives can help in the delivery of babies to these mothers. So, in these cases, when the community is also empowered, the people themselves are involved in helping out their own community, it can help in increasing the health of persons, and to that extent, it can reduce the demand for healthcare. And anti-poverty measures that gives free food to people, ration to the poor people so that they can have at least a basic food and they don't die of starvation, or they don't die because of malnutrition for of children. So these kind of things can be helped by the government when it carries on certain anti-poverty programs which can be used to promote health. And finally, of course, the biological factors that are important in affecting the demand for health. So I hope that these topics, these three papers, especially that of Salma Mashkin, Kenneth Arrow, and Grossman here, these three papers in some way has given you a totally different way of looking at health than just the idea that we fall sick and we go to the hospital and we get treatment. Here we look at the economic way, the concepts that are involved in understanding health, and to that extent you may be able to pick out some ideas that you can use it for your dissertation. So thank you very much. I hope you are watching these videos and fully, and also share them with your friends and subscribe if you haven't subscribed yet. Thank you.